Good evening, everyone. Welcome to Emotion Regulation Skills. This is an event with Dr. Jennifer Hartstein. It's produced by the Wellness Institute. My name is Zalman Abraham. I'm lucky to serve as the director of the Wellness Institute, and I'd like to welcome you on behalf of our entire team and the schools and organizations that should be listed on the slide. There we go. Who have partnered with us to bring this training to you this evening. Firstly, a very big thank you to all of you who are joining us tonight. I know as parents, it can be really challenging to find time in our busy days, but we're very pleased you could join us and learn about this important topic directly from one of the greatest experts really on the subject. Before we start, it would be great if you can note in the chat where you're located and how you might have heard about this event. We have participants from across the community in the US and Canada, and we'd love to know where you're joining us from. I want to note that after the presentation, we'll be taking questions. If you have any questions on any part of the presentation, please feel free to put in the chat. As we do with all our presentations, I want to start with a brief Jewish thought, and we're standing just 2 days before Yom Kippur, the Day of Atonement, the most auspicious day on the Jewish calendar. And interestingly, the word atonement can be read as at-one-ment. It's about alignment. It's about becoming one with our innermost selves. Similarly, the Hebrew word for teshuvah, which is often mistranslated as repentance, repentance implies remorse, guilt, shame for the things that we've done wrong, but that's not what teshuvah means. Teshuvah means return, because teshuvah is a process of returning to who we are, returning to our innermost self. It's predicated upon the idea that at our core, every person is perfect. It's about returning and realigning with that inner core. Yes, it's important to acknowledge any wrongdoings, accept the whole package, the good, the bad, the ugly, but that's not the point. That is in order to enable us to let go of that and to realign with our truest selves, not to fight it. And tonight's talk, at least in part, is about radical acceptance, which is super apropos for Yom Kippur, about accepting ourselves, the whole package as we are, the good stuff, the bad stuff. But it's also important to remember that as much as we need to accept it, it also doesn't define us. We are so much more at our core. So to help us understand this complex topic of emotion regulation and to provide us with some practical skills that we can implement, we're very excited to have with us a very special individual who's a true expert in this space. Dr. Jennifer Hartstein is a nationally recognized clinical family psychologist and a DBT specialist who's been featured in major media outlets like CBS and the Today Show. So without any further ado, Dr. Jen, thank you for joining us.
Thank you for having me. Hi to everybody. One PSA, I think, just to make sure we have everybody, so we don't get all confused about who's talking, just make sure everybody's muted, because I myself have not been muted during big meetings, and then something happens and all of a sudden you hear me. And please, 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 questions at any point, throw them in the chat. We will have plenty of time for Q&A, mostly because I will talk too fast, and that means we will have extra time. So I will do my best to not do that, but I can't promise. So make sure that you have any questions that come up at any point, throw them in there, and we will hopefully get to as many of them as possible. So as Zelman said, I'm going to share my screen with everyone. Hold on, because despite the fact that I use Zoom every day, all day, it doesn't mean I always get it right. So, so we're going to talk about emotion regulation tools, especially for parenting, and how we can use these skills for managing our own emotions as adults in the lives of young people. And in addition to the emotion regulation skills, we're going to talk about validation and radical acceptance, as was mentioned, because those are two very important additional skills that maybe aren't in the emotion regulation module for DBT, but are really important both for parents and to help model for your kids kind of as they are out in the world. And you can do this for any age, and we're going to talk about all of these different elements and how this works. So here's what we're going to go through. We're going to do a very quick definition of what DBT is, what dialectical behavior therapy is. I'm not going to get into a lot of depth about that, but I'm going to give you a little snippet. We're going to define what emotion regulation is, because we want to make sure we're all using the same idea on that. And then we're going to take a couple minutes to just talk about why skills are important for parenting in general. and why DBT, especially for adolescents, really believes that this is an integral part of growth and need. Then I'm going to give you some real, practical, actual emotion regulation skills and talk those through. We're going to talk about validation and radical acceptance. We're going to have time for Q&A. So that's the order of how we're going to do this. So what is DBT? So DBT stands for dialectical behavior therapy, if you didn't know, unless you're my brother and he calls it diabolical behavior therapy because he can never remember what dialectical means. But at its core, dialectical means that two things that are seemingly opposite can both be true. In its most simplistic way to think about this, you can be smart and dumb, you can be strong and weak, you can be interested and bored. So it's the idea that both those things that are seemingly opposite are equally true. And we think about this in a DBT lens when we look at things like pushing people to change while also accepting them where they are. So DBT started as part of cognitive behavior therapy. It pulls from a lot of CBT principles. So if you think of CBT as the overall umbrella, there are many spokes within the umbrella that are the different kind of arms that have developed out of the basics of CBT. So DBT is one of those. It was developed to help individuals who struggle with intense emotion dysregulation. So it was created by a woman named Marsha Linehan, who found that people have very strong reactions, very strong emotions, and then don't always know what to do with them. And the dialectic she found was that just kind of acceptance-based treatments, being in the room with a client, being present, really just saying, hey, I get you, I hear you, I'm sorry you're feeling this way, was insufficient. They weren't feeling like they were then getting anything to help them change, but pure change strategies, try this, do this, change your thought, change your feeling, do all these things, felt invalidating. It felt like no one was really hearing them or understanding how they were doing. So she looked at a way to bring both of these things together. So the idea in DBT is that we are both accepting people where they are and pushing for change. And there's a dance that's happening in that kind of at all times. And within that, we're hopefully building a life worth living for people. We're building real, true, solid life skills that people can engage with that help them in kind of 4 core module areas. I will highlight what those are for you. But with adolescent DBT, there is one additional. So in adolescent DBT specifically, there are 5 core modules that we look at while we're doing the treatment. DBT is also made up of kind of 3 kind of treatment specific elements. So there's individual therapy. There is a skills group that with adults is adults in the skills group and the individual therapy. With adolescents, it's a multi-family skills group. So we include parents and young people in the group together. And then there is an element of phone coaching, which allows clients to reach out to a therapist in between session for extra support. It's kind of like a regular coach. If I was a baseball player and I didn't understand the call that my coach was giving me, I would step out of the batter's box. I would consult with my coach. I'd get back in and I'd hit. And if anybody's a Mets fan, the Mets are winning right now, just as an aside. So coaching is just that. We can't expect you to only wait till I'm back in session to talk to me about it. Especially I work with adolescents and teenagers. If I teach them something today and then they're in crisis or in the middle of it, remembering it might not work, but they can text me or call me and say, hey, Jen, I don't remember, or I tried it, it didn't work. What can I do? And they get kind of in the moment coaching so that we're generalizing all of these skills more consistently. The other 2 reasons to call aside from coaching for skills help is to make a repair. So let's say, like this week, I had a teenager who spent my entire session saying, I don't know, or shrugging. And let's say she realized that maybe that wasn't such an effective way to have session. She could text me and it could be a repair, or maybe I was not as present in that session as I could have been. I can text her and say, hey, I'm sorry I did X. Let's kind of reconnect on this next week. Or maybe they use their skills beautifully and they want to share good news. That's the other thing they get to do. So DBT has those 3 elements within the treatment model, which is one of the things that also makes it a little different than other treatments, is they have access to therapists within boundaries and reason in between sessions. So the 4 main modules of DBT are mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. Walking the middle path is the module that's been added for young people and their parents. We are going to spend a lot of time in emotion regulation, but radical acceptance comes from distress tolerance, which is why that's asterisked, and validation comes from walking the middle path. So mindfulness is exactly right. What are we doing? How are we dropping in? How are we showing up in a present space? Which state of mind are we in? How are we navigating that in our lives? Distress tolerance is how do I get through the moment without making the moment worse? And it's a whole bunch of skills that we teach on that. That's we call them kind of crisis management skills. Like, what can I do right now to help me? They relate very much to emotion regulation because emotion regulation is what are the things I'm doing kind of in the long term that will help kind of put money in the bank for me so that when a crisis happens or when something happens, I have all this good stuff already happening. So emotion regulation is kind of the long-term plan, while distress tolerance is like, I need something to do right now. What can I do? And we need to be mindful in order to use any of these skills. The one thing in distress tolerance that is not a crisis management skill is radical acceptance, which we're going to talk about. Interpersonal effectiveness, exactly what it says. How am I interacting with people in my life effectively? What's not working? What's my goal in this relationship? How do I ask for something appropriately? All of those pieces so that I can build positive and healthy relationships. And then walking the middle path is about parent and teen dilemmas. It's really looking at the challenges that they face, the arguments that they might have, where they might fit on different continuum of like, am I holding on too tightly to a kid who needs more independence, or am I giving independence too much to a kid that needs more guidance? It also looks at behavioral principles. How are you reinforcing behaviors you want? How are you ignoring behaviors you don't? And lastly, it talks about validation. And validation is so important in relationships in letting people know you feel seen, heard, understood. So we're going to talk about that in more detail as well. So why are skills important for parents? I'm sure if I was able to throw this question out, everybody would have different answers, and a lot of these answers would overlap. So my answer is, if we are trying to model for young people in our lives the most effective way to manage our emotions, we have to know how to do that first. This is true at any age, from toddler through young adulthood, right? As long as you are parenting, you also need to be able to understand your own emotions, to be able to recognize what they are, to be able to manage when there is a crisis. So if your 11 or 12-year-old is being kind of bratty and obnoxious and pushing back and doing all this stuff, and you escalate with them, nothing happens, everything blows up, no one's in charge, and no one's getting their needs met. And everybody leaves feeling very disconnected and unhappy. But if I can recognize that my emotions are going up and say, hold on, I need a minute here. And you can even take a break, or you can say, hey, I need a minute. Do you need a minute? Let's do some breathing together so we can both kind of get more mindful in what we need. Now we're working on it together. So skills are so important because it's not just one, like when one person in a system is dysregulated, the whole system is dysregulated. It's the adults that need to regulate the system. We cannot expect young people to do that. They don't know how. And many of us as adults don't know how either. And we're not perfect all the time. And you're not going to be skillful all the time. Let's not pretend you will be. I know these skills backwards, forwards, upside down. I am not skillful all the time. My husband will attest to that if he were here. So let's remember that we want to be as skillful as we can. But as parents, the more skills we have in our own arsenal, we can use them, we can model them, and we can actually teach them to our young people. So I think this is really the key in most of this, and why this is such an important thing. We often focus on like the identified problem or the identified patient, but in DBT, especially in adolescent DBT, we look at the whole system, which is why we have a multifamily group where we have parents and young people together, because then everybody's learning the skills at the same time, and everybody can work on skills at the same time. And that is really vital in changing the nature of the system. Only one person changing, systems like to stay the same. No, systems don't like to change. So if the whole system is engaged in change, we can promote more of that along the lines. So what is emotion regulation? So emotion regulation describes essentially how we manage and respond to our emotions. It's kind of that simple. And if you think about people in your life, who you work with, yourself, problem X may be like water off a duck's back for you, but really dysregulates someone else. But problem Y really upsets you, and someone else looks at you like, why is that bothering you? I don't get it. So we all have different thresholds and we all have different levels of acceptance that we can have. And we all have different ways we regulate our emotion, but it's essentially how we do it and how we respond to the things that kind of trigger the different emotions we might have in our lives. So these are two of my favorite phrases that I use with the people in my office at all times. You cannot be skillful if you're not mindful. So although we're not talking about mindfulness today, being mindful, being present, being in the moment is fundamental in being able to access any sort of skill usage. If you're predicting a negative outcome, if you're like, I'm going to try this, it's never going to work, this is going to turn into a big thing, yada, 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 you're not in the moment, right? And we cannot be as skillful as we would like to be if we're not in the moment. And my other favorite one is you can't be mindful if your mind is full. So if we are trying to problem solve, forgetting that there's another person involved, only focusing on outcomes and not just focusing on like what's happening in front of us, we're kind of dead in the water. So it's so important to just slow down. One of my brother once said to me, everything can wait 5 minutes. And at the time I was like, I'm a New Yorker. Nothing waits 5 minutes. Like you move, you make it happen, you go. And he was like, everything can wait 5 minutes. And it's kind of become my mantra. If I'm starting to feel racy or rushed, or I have to do something, I'm going to make a mistake. I'm going to say something I don't mean. I'm going to act in a way I might not want to. So if I can hit the pause button, tap the brake, take a breath, slow myself down, I can make a different decision. So both of these phrases are really important in my work and in my kind of general life space, because I feel like when I am not mindful, all skills go out the window. And I see that. And then I see how the trickle down of that happens in relationships, in all of those other things. So it's just things to kind of keep in mind as we're going through this. Okay. So the goals of emotion regulation are fourfold. And when we look at DBT and we get to this module, we go over what the goals are with the families with whom we work, right? So the first thing we want to do is understand the emotions that we're experiencing. Most of us forget the value and need of emotions in our lives, and that what emotions do is they communicate to other people, they give us information about other people, they might actually push us into action, right? So fear might push us into action that we need to leave or move or change. So it helps us understand by identifying and labeling and clarifying any of the emotions we are experiencing or people around us might be experiencing. One of the other goals of emotion regulation is to help us reduce our emotional vulnerability. We're going to talk about this. There is a very specific skill focused on how to help us reduce our own emotional vulnerability. There are a lot of things we just don't think about that make us more vulnerable to our emotions, that, hey, if I paid better attention to that, or I was more careful in this area, maybe I'd be more protected, and they become protective factors for us that we want to pay attention to. Another goal is to decrease the frequency of unwanted emotions. If I engage in pleasant activities or things that bring me joy or things that I like, that again is that money in the bank, so that when if I've got good stuff going on the scale and something negative happens, but I've got all this good stuff, that negative thing isn't going to tip me over. It's going to bring my scale maybe back into balance, or maybe tip me a little bit. But the more good stuff I can have, then those unwanted, overwhelming emotions aren't going to be so present. And lastly, emotion regulation skills help us decrease emotional suffering, right? We're using unwanted emotions because I think the way that DBT looks at it is that a lot of times emotions are just super overwhelming. So I don't love like good emotions, bad emotions. I think that's nonsense. But there are times when like I don't want to feel anxious when I go to a party. I want to be able to walk into the party feeling okay and not feeling overwhelmed, so overwhelmed that I can't go, or that I decide to stay home and then I don't go. So what we want to think about with emotion regulation is, what are those unwanted emotions? Can we reduce them to some degree so that we can engage in our life fully? Excuse me. So like I said, why do emotions matter, right? They give us information. They give us a ton of valuable information, both for ourselves and with people in our lives. One of the things that I think is hard is we cannot mind read how someone is feeling, but we get a lot of cues, right? As we say, communications communicate to and influence others. So if I see someone crying, head down, bent over, kind of closed in on themselves, I can probably assume that that person is sad. Maybe they might be angry. But then what I need to do is actually ask them the question. And there are times we are so wrong. And I will give you an example of a day that I was like so wrong, but it was actually funny. I was at an event a couple of weeks ago, and I walked by one of the people that I was doing some of the work with, and he was sitting on a bench and he had his kind of head in his hand and he was like rubbing his eyes. And so I was like, oh no, what happened to Jay? Like, is everything okay? He looked like he was getting bad. He was on the phone. He looked like he was getting really bad news. So I like sneaked into the bathroom, grabbed a box of tissues, was about to hand it to him. And when I walked back the second time, he was cracking up. So maybe his eyes were just itchy. I don't know. But I read the whole situation totally wrong. Fine, because the body language and my interpretation of it didn't go together. Now, if I did that to someone that I was sitting in a room with and I was like, gosh, you look so sad right now. If we're wrong, especially with children and adolescents, they are not shy. They will tell you you're wrong. They will be very clear and they will like, I'm not sad, I'm angry. Awesome. Guess what you just got? Fabulous information. And then you can actually talk with them about, well, why are you angry? And what can I do to help you? And how can I sit with you in this? But we get a lot of information. It goes through our own lenses, and then we need to really think about how to communicate and talk about them. And emotion regulation gives us some strategies on how to manage it, but asking questions is really helpful. And then emotions motivate and prepare us for action. So when I am anxious, it prepares me for action. When I am sad, it prepares me for action. All of these pieces work together, and that's really important for us to be thinking about. So one of the big skills, probably the biggest kind of one of the most important skills in emotion regulation strategies for DBT is that we want to do a skill it's called ABC Please. We're going to start with the ABC. And what ABC is, it's about increasing positive emotions. And the please is about reducing the vulnerability to emotion. So ABC stands for accumulating positive emotional experiences, building mastery, and then coping ahead of time with potentially emotional situations. We're going to get into this in a lot more detail. Please is the reducing the vulnerability part, and it's treat the P and the L are in the physical. It's a little corny, but I didn't make it up, so just go with it. Treat physical illness, balancing your eating, avoiding mood altering drugs, balancing sleep, and getting exercise. So we're going to talk about both of these skills separately, but they come together, and you can see why, right? As I want to increase stuff, I also want to decrease the other. We want both those things to kind of be going in tandem. So accumulating positive experiences. The first question we want to ask, what can I do right now? There are so many things we don't think about, right? A positive experience could be as simple as saying, every morning when I get up, I'm going to get up 10 minutes earlier so the house is quiet, and I'm going to have my cup of coffee by myself, or my tea, or my cereal, or whatever. But I'm going to do that by myself. And I'm just going to take that time to have some quiet where I can enjoy the birds, looking out at the window, I don't know, watching news with no one interrupting me, using the bathroom by myself, whatever it is. You create some things that you can do right now. And it doesn't have to be big, but you want to have as many options as possible. And you also want to have options that you can do with other people, especially your kids. So let's say your kid loves to bake. Well, what a great positive experience that you can do with your child that kind of fills both of your buckets. And then that's this, if you put 5 cents in every day, it's going to accumulate over time. If I put nothing in there, I got nothing. So the more small things we can do, the more it builds up to big things. And then and by the way, if you can do a big thing, awesome. Hey, what can I do right now? I've got an hour. I'm going to go take a walk in the park, and I'm going to not be on my phone. I'm going to put on music, or I'm going to go with nothing, and I'm just going to notice what I notice and be in the moment. So all sorts of positive experience can mean something different to everybody on this call, but I really highly recommend making a list, right? What do those positive experiences look like? What can they be? And then make a list that's all for you. And maybe that's, I like to knit, so I'm going to knit every day or I'm going to knit as much as I can, because the more positive experiences you can do every day, the better, right? So we want to build this up. This is something you want to build as much as you can. You want to kind of build the positive experience muscle. Because as I said before, the more positive experiences I have, when a negative thing comes, I'm going to get, if I have nothing and I'm like here, and then a negative thing comes, I got nothing on the positive side. But if I've got some good stuff, I've got reserves, I have memories, I have positive emotions that I have built up. So a negative thing doesn't take all of that away. So make one list that's really all for you, and make a list that you can do with other people. Lists that you can do with partner, children, friends, whatever. But having both, and maybe even have those other people in your family make a list of things that they can also do with you, and you guys can do this together. And that in and of itself could be a positive experience. But here's the thing. Anybody ever go on vacation and you get 7 days, and on day 2, you're like, oh, I'm having the best time. This is so great. I can't believe I only have 5 more days. And on day 3, you're like, oh, we're having so much fun. We've done so many great things. We only have 4 more days, right? That's not being mindful of your positive experience. That's actually being mindful of when your positive experience is ending and leaning into the negative. Being mindful of your positive experiences. We've been here 2 days. It's been wonderful. I'm so excited we have 5 more days. It's a small shift in how we approach it or what we say to ourselves or how we're talking, but it's allowing you to be mindful of what's happening. You could take it one step further and say, God, we've been here 2 days. It's been amazing. And say nothing else, right? But we often take away the positive thing that's happening with what's to come. Ugh, I don't want to go back to work tomorrow at 8 o'clock on Sunday. I am guilty of that. Oh, it's Monday tomorrow. God. And it's like Sunday morning. Well, I have a whole free day to do whatever I want. Lay on the couch, watch TV, take the dogs for a walk, hang out, cook, bake, whatever. But I'm already thinking about what's happening on Monday. That's not being mindful of the experience I'm in this moment, right? When we're like waiting for it to end. So it's so important. And this is where mindfulness comes in, right? It's so important for us to be mindful of the experience we're in this moment. Because what happens is that's like your nickel just became 50 cents because you're so in it and you're so engaged and you're so participating that all the other noise goes away. And I'm sure we can all think of experiences where you've lost track of time, where you're like, went to a concert or you went to an event or you were at a party or you were just with someone you really cared about. And all of a sudden you're like, oh my God, 4 hours just went by. How'd that happen? Right? We've all had that experience. That's kind of what I'm talking about. That's being so engaged and so mindful that all the other things fly away. You're not thinking about the end. And that's so important in emotion regulation. Which kind of the converse of that is being unmindful of worries. What's going to happen? Did I say something stupid? Oh my God, am I going to be able to be okay for work tomorrow if I do these other things? Our self-talk, like, we have most of us have a constant ticker tape at the bottom of our thought log that's just thoughts, constant, constant, constant. And a lot of those thoughts aren't so great, right? Let's be honest. There are a lot of like self-doubt and criticism, and the inner critic is like yelling at us and all of this stuff. Don't say that. Don't do this. Don't make that face, right? We do that. But then we're paying attention to the worries, pulling us out of the positive experience. So when you notice those thoughts come up, acknowledge them. Hey, I hear you, you negative thought, but I'm not paying attention to you right now. Hey, I know that works tomorrow, but it's still Sunday. I'm going to enjoy this moment, right? So we're kind of letting go of those worry thoughts, letting go of that negative chatter so that we can be fully engaged in what we're doing right now. And that's really what the A is. And the A, why is this important for parents? Well, if you are not able to be your best self and fill your own bucket, what do you have to give to your children? Right? If you're depleted, and right now, many of us are depleted, but if you don't give back to yourself at all, you've got nothing to give to the people who are relying on you. So finding moments for these experiences. And again, it doesn't have to be complicated. Call your best friend, send a meme, share, take a walk, take a drive, blast your favorite song and dance around your living room, whatever it might be. But do stuff that fills your own bucket, because we know, right? There's the old adage, if you don't put on your own oxygen mask, you have to put your own oxygen mask on first before you can help anybody else. It's really true. If you've got nothing, you've got nothing to give. So you need to have these positive things that you're filling up your bank with consistently. So what do we do in the long term, right? We want to do some evaluation of like what kind of changes might be possible so that I can have positive events occur more often, right? So if I want to do like one of the things that I changed a few years ago was I know how much exercise fills my bucket. And I know how much that doing it with other people fills my bucket. I don't love I'm not a put headphones in and go run by myself. Like I want to go for a walk with my friend or I want to take a class with somebody. And so I made it like a non-negotiable several years ago that in the mornings I had workout time. And it's in my calendar and it's in everyone that knows me's calendar. So those are like it might be 6:30 to 7:30, maybe it's only 6:30 to 7, whatever I can get in, but it's like because I put it in my calendar and I just kind of like this is a non-negotiable, this is a non-negotiable, this is a non-negotiable, it happens more often, which makes me feel better, more consistent, which allows me to be more present in my life overall, right? So if I want to do this coffee, I want to get up 10 minutes early and I'm like, it's never going to happen 7 days a week. Start with one, put it in your calendar, build to two, build to three. How many days do you want it to happen? You want to make sure you talk to your best friend once a week, schedule a time, right? So create systems and strategies and opportunities so that these things can happen more consistently in your life. We often, especially parents, drop ourselves and our needs to the bottom of the list. And that's not helpful, right? Bring yourself back up. Your needs matter. Your positive emotions matter. When you are more positive, you're modeling that for your kids. We want that to happen, right? The second piece is that when we identify the goal, so we identify that we want to make this change. Here's the goal I want to do. We want to work towards whatever that goal is that aligns with your values. So if health and wellness is a value that you treasure, or connection is a value that you treasure, or work is a value that you treasure, but you want to have work-life integration, I'm going to use that instead of balance because I think work-life balance is a whole different talk and a whole different thing, but a little bit of a myth. So we have to figure out how to integrate it into our lives. What are those things? And I want my goals to align with my values because guess what? If they don't, never going to happen. I'm never going to do them. I'm not interested in them. They're out the window. So once I identify what the goal is and how it aligns and, take some time to really like invest in figuring this out, what's the first step that I need to do towards achieving that goal? So if I want to make sure I talk to my friend once a week, and that's my goal, and that aligns with my value of connection, what's my first step? Hey, is this something you're interested in too? Question mark, right? I need them to be on board with me. I can't do it by myself. So once they're on board with me, step two in my goal might be like, okay, let's find a time. And we're negotiating that. So we need to no goal. None of us can just be like, I want that to be the goal. And like, poof, magic. It happens, right? We have to know what the steps are. We have to take the steps. We have to move towards the steps. The thing that often interferes with us doing that is our fear that it won't work or our fear that we're going to fail. But failure is an opportunity for learning. So if you fail, great. What do you need to do differently? How do you change it? What's the next step? So these are the long term, like what changes do we want to make in the long term? So we're building up as much positive experience as we can. Now, I don't want to be a Pollyanna and pretend that all of this is going to make your world like roses and rainbows, because it's not. But the more positive stuff we have, the better equipped we are to deal with the negative, because the negative stuff's going to happen. Like we can't avoid it. That stuff presents itself. So being mindful of what the positive stuff does protects us a little bit from that. So that's the A, right? We want to accumulate as much positive experience as we can in whatever ways we can, both in the short term and in the long term. The B is building mastery. So it's exactly what it says. How do I become like more of an expert in this thing I really want to do? So, there's the phrase like do one thing every day that scares you. Okay. Well, if I do that thing that scares me every day, guess what it teaches me? Competence. It shows me that I'm capable of doing it, right? Zelman mentioned that I do things on TV. It wasn't like the first time I walked on TV, I was like, I got this, piece of cake, no big deal. I'm a pro. I was like shaking like a leaf. I didn't know what to do. I watched my clip back incessantly to make sure how I made it better. Every time I went on TV, it got easier. I got less nervous. I felt more comfortable. I felt like I had it. So the more we do those things that are challenging, the easier they become. And this is important not just for us as adults and parents, but for the kids we are in, that are in our lives, because often they're afraid to do something that's scary, so they avoid it. Avoidance gets reinforced because I feel relief when I avoid something, but it doesn't actually make me feel confident. Or we see a kid struggling and we jump in to fix it for them, but that actually takes away their own ability to build mastery. So we want to be thinking about how we can help all areas be building mastery, right? We want to plan for success and not for failure. And if we fail, it's not the end of the world. We will be okay, right? We will learn, we will reconfigure, we will figure it out. And lastly, if you start with the most difficult task on whatever list you're doing, you are bound to fail and you are bound to quit. So start simple, right? I don't knit, but if I decided to start to knit, I don't think my first thing to knit would be like, I'm going to knit a sweater. I'd probably learn how to knit a scarf, right? And then as I figured out that, I would maybe go to a hat, and then maybe from a hat I'd go to a sock. But each thing will be gradually harder because I've mastered the thing before it. But if I don't practice and I don't try, none of this matters. So one of the things we really need to be teaching young people is that repetition is important, trial and error is key, and that the more we practice, the better we get. And we can't interfere with that, because when we see our young people struggling, we want to swoop in, we want to fix their discomfort, because that's our emotional problem and not theirs. So when we can regulate our own emotions there and step back and be like, do I need to do that, we give them the space to learn and grow. So all of that is really important. The C, cope ahead of time with emotions. This is a hard one, but probably one of the most important ones, right? So if I know that, like, we'll use tonight as an example. I know that I'm doing a talk at 8 o'clock. I had a long day at work. I'm tired, which makes me more vulnerable. And I'm anxious because I'm doing a talk, and those normal reaction. I'm excited, but I'm anxious. So I had to think about, all right, how do I make sure I have time before I do this talk to slow myself down, eat a little dinner, get myself regulated? So I needed to kind of think earlier today how to make sure that I didn't get on and like have dry mouth and be really anxious and like all over the place and make no sense, because that would have wasted everybody's time, right? So we want to think about what there are probably situations all of us have that trigger different emotions in us. And I probably can name 5 off the top of my head, as I'm sure most of you can as well, that we want to be thinking, okay, so if that person, and not to predict a negative outcome, by the way, but just if that person says X to me, who can I turn to? Or how do I get myself out gracefully? Or can I just let it roll off my back because it just doesn't matter? So we don't want to predict a net, like, I'm going to walk into this party and that person's going to ask me this question that they always ask me and it really irritates me, and you're going to walk in mad. We don't want that. But if in fact they do that, I can say, it was really nice talking to you, and walk away. Or I can look at my partner and be like, wrap it up, we got to go, or whatever. So we want to have, like, it's almost like your like disaster plan for triggering situations, so you know how to navigate it. And I will give you an example of a teenager that used this. They had a teacher in school that was just really hard for them, and they just would butt heads all the time. And they needed to go talk to this teacher about a paper they were writing, and they were really confused about the prompt and they needed some help. But the teacher and this kid, they just didn't get along. So we did a lot of, okay, so how do you walk in to ask for what you need and not make yourself small and not trip on your words and kind of take up the space you need to ask the question? The teacher is there to help you. And we talked a lot about how to prepare so they didn't walk in so anxious and doing that, I know you're going to say no, or I know you're going to think this is a stupid question, like while wringing their hands. And so once they had a little bit of preparation, they could walk in and say, hey, I'm confused. Can you help me? And it changed the whole dynamic of the relationship, because they were able to be prepared that they were going to be anxious talking to an authority figure, and they still needed to do it. So coping ahead is not about predicting a negative outcome. It's just like, this could happen. How can I be prepared as best as possible? So that wraps up the ABC please, right? I mean, the ABC part. The please part is really simple, but we all have to think about it. So please is about reducing our vulnerability to our emotions. So things like treating physical illness. When we are sick, we are not well equipped to manage emotions. I am not a nice person when I am sick. I am cranky. I am obnoxious. I am needy. I just want everything to just like be done and fix itself. And yet life goes on. So if I take care of that, I might have better, it might not be perfect, but I'll have better control over my reaction. When we don't eat well, right? Most of us, when we feel a lot of emotion, we lean into comfort food. My favorite comfort food is French fries. French fries do not make me feel so good. I love them, but they do not make me feel so good. So that actually makes me feel worse, right? So when I'm not upset, how am I balancing my eating? What can I be doing so that I'm just kind of more even keel? So I'm not drinking a ton of caffeine and spiking up my energy and then crashing, or eating a lot of carbohydrates and then crashing, or eating a lot of sugar and then crashing, right? How am I kind of figuring it out so I can have some balanced, and then my blood sugar is balanced and my mood is balanced and all of those things. And that includes making sure you're hydrated. Avoid mood altering drugs. Many of us, stressful day, come home, we have a drink. And yet, we all know alcohol doesn't really help us manage our emotions so well, right? So we want to be mindful of what we're doing and how we're using it. That's not to say don't have a drink, or that's not to say don't use other drugs you might want to try, but be clear as to why you're doing it and what the purpose is, and not using it as an escape or an avoidance. Sleep, we cannot minimize how important sleep is. And most of us don't do a great job of balancing it, because maybe all the kids are finally asleep at 10 o'clock. And even though I am exhausted, I have 16 things I need to do. And now it's midnight, or it's finally time that it's quiet. And I want to just watch a program and I get wrapped up in that for the next 2 hours. But then I wake up exhausted. So sleep is like fundamental, because it actually helps us make better choices, be less impulsive, manage our emotions, all of the things we're talking about. So you may never get enough sleep, but can you get quality sleep, right? And I don't need to go into how we all do that. We all know how to do this. Get off your screen, stop watching TV, put your phones down, set a good bedtime, shut the lights off, blah, blah, blah. But it's really hard. So you might need to figure out which of these is priority for you. And the last one is get exercise. That does not mean you have to go to the gym. That does not mean you have to like have a trainer. That could just mean you walk up the stairs instead of taking an elevator, or you walk around your block, or you play with your kids. But moving your body is so important to managing emotion. Fundamentally, it gives you a dopamine hit. So if you're feeling low, it actually increases your mood. So all five of these are super important in decreasing our vulnerability to our emotions. And if it all feels a little overwhelming, like pick one, focus on one that you can work on and kind of make that the focus for a little while until some new habits are built there. And then you can shift gears to something else. Okay. So that's ABC, please. Really big, important emotion regulation things that are very action oriented, very easily integrated into your days and into what you need to be doing. But another thing to be thinking about is that there is a really important skill called opposite action, because every emotion we have, for all of us, comes with very specific action urges. So when we are anxious, we want to avoid the thing that makes us anxious. When we are sad, we often withdraw. When we are angry, we often want to attack whomever, whatever is making us angry, right? Or we want to like throw a temper tantrum. So there are very specific fundamental action urges that happen with very clear emotions in our lives. And those urges push us to act in specific ways. The problem is sometimes when that urge is strong enough, it actually creates more problems for us. For example, I'm anxious about going to school, so I decide not to go to school, but that creates more problems for me in the long run. Or I'm anxious about making that phone call, so I just don't make that phone call. And yet, without making that phone call, my boss gets angry, and then there's a problem, and then things fester and things get bigger, right? So we need to consider alternative ways of handling these situations. And that's where opposite action comes in. So opposite action, the definition is acting opposite. I know we're not supposed to use those same words in a definition, but we will. Acting opposite to the action urge when the emotion and the action in that emotion may be more harmful than helpful. What does that mean? I wake up, I'm anxious. I don't want to go to school. I'm 13. I'm having some problems with my friends. I'm anxious. I don't want to go to school, but I have a test. and I just don't want to go. And my parent is like, you got to go, you got to go, you got to go. Well, if my parent can regulate themselves because my anxiety triggers my parents' anxiety and say to me, hey, what can we do? Let's use some distress tolerance. Let's get you breathing. And let's approach the thing that's making you anxious versus avoid the thing that's making you anxious. So that's the opposite action. Let's just get you to the school bus. I'll drive you today. Let's just get you to school and let's see how it goes. And let's take it minute by minute, right? But the opposite action is very often just that. If my urge is to avoid, I need to approach. If my urge is to withdraw, I need to get involved, right? If my urge is to attack because I'm angry, maybe I need to avoid kind of temporarily, right? Because we want to do the opposite so that we can regulate and or see that there's success. And when we do opposite action, we got to go all the way. So if I'm socially anxious a little bit and I'm going to an event where I don't really know anybody and I show up and I stand in the corner, that's not really opposite action. I showed up, go me. But I also maybe like if I'm doing it all the way, I need to like engage, right? So opposite action is a challenge because it forces us to push through those hard emotions and those challenging moments. But we come to the other side feeling better, building mastery, noticing that we're capable and building that competence that helps us continue to practice action, the opposite action of those action urges, right? Super important when our urges are to shut down and close off, because oftentimes for so many of us, it doesn't actually help us. It makes things worse. So we got to be mindful of when those things happen. Okay, so those are the two big emotion regulation skills, kind of 3 or 4 of them that I want to focus on. And they're all kind of basics for just kind of getting us engaged in our lives and keeping us involved and keeping us connected to the people in our lives, because we know how important emotion connection and emotional communication is. But we also need to think about how to validate the emotions we're having, right? Now, what is validation? Validation is the idea that you see, hear, and recognize how someone is feeling, thinking, or acting. It does not mean you approve of what they're doing. It just means you're acknowledging what they are doing. So this is where a lot of people get caught, because we think of what the base of validation is. It's valid, which means true. And so that means we must agree that what you're doing is fine. Well, no, but any feeling someone has is valid. Any feeling anybody has is valid, period, end of sentence. You cannot tell someone, although we do it all the time, you cannot tell someone not to feel a certain way, right? What may not be valid is how they act on their feeling. So that 13-year-old saying, I'm anxious, there's so much going on at school, I can't make it. And they're like throwing themselves on the bed and they're like, I'm not going. And they like lock themselves in their room. And then you're like, come on, you got to go. And they're pushing you and shoving you or crawling under the bed. Those behaviors, that could be where the problem is. But the feeling of anxiety, 100% valid, right? So we always want to validate the valid. Hey, I see you're anxious and you still got to go to school. So what can I do to help you get there? Okay. So it is not approval. It is acknowledgement, acceptance, recognition, but it doesn't have to be approval. You don't have to agree with how that person acts or feels or thinks, but you want to acknowledge that you see, hear, and recognize them. A really fascinating way to think about validation is I work with a lot of suicidal, self-harming teenagers. I can 100% validate that they feel so awful that self-harm feels like the only option for them in that moment. I can validate that and still tell them that we're going to work to learn skills so that they don't self-harm, because I can't validate the self-harm, right? I can't say, yeah, no problem, self-harm away. I mean, first of all, that'd be super unethical, and I don't believe that. So we want to validate what we can. So always validate the valid. So if your kid comes home and is like, I failed my test, and they were on screens or goofing around and they didn't study, you can validate the feeling of disappointment they have. And most of us are going to go, but you didn't study, so of course you failed your test. Whereas if we want to have that relationship and that connection, we really want to just say, hey, I'm really bummed out for you, and I'm sorry that you're so upset that you failed your test. And that might be all you say in that moment. And an hour later, you might go back and you might say, hey, I know you didn't really study for that test. So I know you're upset about it. We need to talk about what you can do next time because I can't validate the lack of studying, right? So what it is recognition, acknowledgement. What it is not is acceptance of behaviors or things that you don't agree with, or kind of validating the invalid. Like, well, yeah, of course, of course you're upset that you didn't pass that test. Like the teacher gave such a hard test. Like, no, you didn't study. So we want to be mindful not to validate and
Well,
reinforce the
study
invalid,
that. Open it up, and
right?
there
So
should be people.
why is this such an important thing to do? Because if I say to you, hey, I see you, I hear you, I recognize you, we're connected. And you've kind of climbed down into the hole with me and are holding my hand. It's more on the empathy side than the sympathy side, right? It's really that's kind of like, I am going to sit in this with you because I see you and I hear you and I recognize you. And it gets you miles, miles. If I can say to someone, hey, I see you're having a really hard time and how you're handling it really isn't okay. I see you though. What can I do? How can I be here for you? That person feels really heard and really seen. And that's like an honor to kind of hold space for them in that way. Not only do we need to validate other people though, folks, but we need to validate ourselves. Anybody like make a mistake and go, God, I'm such an idiot. I can't believe I did that. Or why am I feeling so upset about this? Like, it's so not a big deal. Like, I don't know why this is bugging me so much. Just me. Like I do that all the time, right? I kind of question and self-invalidate. But there's no reason to do that either, right? I have a right to feel how I feel. And when I self-invalidate, it doesn't really make me feel so good. It makes me feel pretty crappy. And then I question if I'm reading the room right, or if I'm doing things right, or if I'm, so validation also helps me kind of go, if I'm doing it for myself, be like, right, okay, what do I want to do about it? What's the action I want to take next? How can I fix it? Or do I just do nothing and just kind of be okay? And when we do that for other people, it allows them to recognize they don't need to look externally, that their internal experience is okay. They don't need to look to the external part of the room to see if they're feeling it okay or being okay or whatever. They can trust that how they're feeling is okay. And that is so powerful for young people, especially. Right. The other thing I don't have in here, but I'm going to point out a really important communication style is we often validate and then say, but fill in the blank afterwards, right? We kind of say, hey, I see that I understand that you're really having a hard time, but you really need to go to school. Okay, well, everything I said before the but just went away. You just took it all away. You basically just were like, yeah, you're telling me you hear me, but like you don't really care. You're not, right? Anybody ever have a kid push back to you on that moment, or like you notice yourself fighting with yourself? But if I say, hey, I know you're having a really hard time and you're really anxious about school and you still need to go to school, and we use kind of a both and mindset, I can now hold both those things in my head at the same time. But takes one away. It makes it an either or. So shifting to a both and, validation and change, which will feel very awkward when you first start to do it, but is really important. If you can switch that word, little teeny semantic change, now we can hold both things in our head at the same time and we can start to problem solve, or we really know that you heard us and we can do something different. So paying attention to that both and also it gives you a ton more options. Hey, I know you're having a really hard time and you need to go to school, and I can drive you, and we can go late, and we can, what are all the different options that you can come up with? So that small semantic change is a really important one because it doesn't take away the validation you put on the table for people and for yourself. Okay. Which leads us to the idea of radical acceptance. Probably the hardest skill for almost all of us, and a beautiful way to have started our talk tonight is, what is it? So when we're thinking about radical acceptance, the idea is that we are fully and completely accepting a situation as it is. So hard, feels impossible, and it's doable. So when a serious problem comes into our lives, we have 5 options. We can figure out how to solve it. Not always something we can do. We can change how we feel about it. And I'm going to add into that, which I should have done on this slide. how you think about it, because changing how you feel is actually really hard, but changing how you think is a little easier. If we could change how we feel, wouldn't we all just be like, I don't want to be sad anymore. I'm not sad. Like, it's impossible. So, but if I change my thoughts or I change my behaviors, that might work. Number 3 is we can accept it. Number 4 is I can stay miserable, which is kind of like I do nothing and I'm just unhappy about the situation as it is. Or number 5, maybe I actually do things to make things worse, right? Maybe I have a coworker who I really don't like, and I just start to do things that sabotage them, and I just make the whole situation worse, right? Instead of being like, I don't really like this coworker, but they're my coworker. So what can I do to make this work? What can I do to help myself? Oh, there's nothing I can do. Okay, so that's a coworker. So like, I'm going to keep going about my day, right? So the thing to think about acceptance is, again, just like validation, acceptance does not mean approval. I don't have to like the thing I accept. COVID is a perfect example. So many of us had to shelter in place, right? We had to wear masks. We had like life shut down for a period of time across the country. Most of us had to just go, okay, what can I do about this? I can't see my family right now. That sucks. I'm really sad about it. Okay, what can I do? Probably nothing. So how do I make it work for me? Or how do I make it okay enough that I'm not suffering? Because the whole idea about radical acceptance is to help us decrease our emotional suffering, right? It doesn't change the problem. It doesn't solve the problem. It doesn't fix the problem. But if I can accept it, I suffer less. So I was talking about this today with one of my clients who's a young adult. She's in her late 20s. And she's like, she hates radical acceptance. She hates it. She has hated it for the many years that I've worked with her. She doesn't understand it. So we were talking about it. And I said, look, you actually practice radical acceptance at work. She's like, no, I didn't. I said, let me give you the example. You had a coach, she's a teacher. You had a co-teacher. Your co-teacher didn't do her job, was really ineffective. You didn't like her. You had a lot of options on things you could do. You tried to solve the problem. It didn't really work. They weren't going to fire her. You had to be in the classroom with her. You tried to change how you felt about her. Didn't really work. But you still showed up for work. You still worked with her. You came up with strategies on how to navigate it as best you could while accepting that for the next couple of months she was in your classroom. And it made work better, not great, but better because you were suffering far less. And if we don't practice radical acceptance, we stay stuck in our suffering. Some of us like to stay stuck in our suffering, but most of us do not, right? So if we can use acceptance in this way and just being like, and this is truly, it is what it is, but not in that like, it is what it is, which is super invalidating. It's really, it is what it is. No more, no less, just here, right? And for those of you that know the serenity prayer, right? Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Welcome to radical acceptance. That's also what this is, right? It's really the skill of accepting those things that you cannot change. And there's a lot in life we cannot change. That if we can just be like, okay, this person is who this person is. They are never going to be the person to initiate a plan. Okay. I still want them in my life. I still want them as my friend. I'm going to work around it. So we figure it out so that it kind of works to us and we're not grumbling and angry and frustrated all the time, because that doesn't really help us or help anybody that we're with. Okay. So let's put all of this together because it's a lot. So we have to kind of drop an anchor into a mindful place, be present to recognize what our emotions are. When we have an emotion, we need to validate that that emotion is what it is. We don't want to change it. We might want to ultimately change it, but initially, God, I'm feeling so frustrated and so angry right now. Just validate it. Saying it out loud is validation. Acknowledging it is validation. Both of those things are really important for us to do. And then we might be like, what can I do? Can I do a pleasant activity? Can I eat something? You know, am I having this reaction because I'm hungry, because I'm thirsty, because I'm tired? What is it? And if it's any of those things, can I do anything to kind of help myself so maybe I feel a little less irritable? And maybe I'm irritable because there's some really loud person outside and they're just making a lot of noise and they're driving me crazy and there's nothing I can do about that. So Can I put on some music? Can I make a change? Or do I have to just be like, okay, it's going to be loud for a little while and there's nothing I can do. And I'm just going to have to kind of be okay with that. Right. So all of these things build on each other. How is this important for parents? Well, kids push your buttons. Let's be honest. They know better than anybody in your life how to get under your skin, how to tap into your insecurities. They also know how to bring you joy and happiness and all of those things. But those things don't dysregulate you, right? Those things make you feel good. So the things that dysregulate you are the things we want to be paying attention to. So when you're feeling dysregulated, how can you bring in some emotion regulation skills? How can you validate your own reaction? How can you validate the reaction of your child who's maybe having a big reaction? And how does radical acceptance fit into parenting? In so many ways. You may want your kid to be like this, and your kid's like this. And we have to accept that our kid is who our kid is. You want your kid to go to Harvard and they want to go to trade school, and that's going to make them happy. You might have to radically accept that that's what is, right? So I think parenting is kind of the perfect place to be thinking about how to practice radical acceptance, because otherwise, I don't think people would be parents and we'd be banging our heads against the wall all the time. Because there's a lot of things so out of your control that you just have to kind of be able to roll with it. Or you have to pick and choose the battles that you have, because sometimes it's just not worth fighting for things that are kind of not as important, right? And you want to validate all throughout. I'm working hard, I'm doing my best, I'm making it happen, I'm doing what I can do. And how can you kind of bring all the people in your life into that as well? And the more regulated you can be, the better you are at creating those moments, right? So that's how they all kind of overlap and build on one another. All right, and Mushki, I think we're on Q&A. Oh, look, 5 after 9. Go me. Woo-hoo. Let's do it. Q&A.
All right. Thank you so much for that
Yeah.
extremely clear and practical presentation.
I will stop my share. There you go.
We will jump right into Q&A. By the way, I'm
Yeah.
Mushki Lipsker from the Wellness Institute, events coordinator, and thank you so much to Dr. Jen for being with us tonight. So you can all start putting in your questions and I will do my best to get to all of them. We will start with one question that came in so far. I'll start with the one that just popped in. Can you talk about your experience working with teens or young adults with either traits or formal BBT, BPD, and
Yeah,
using
I can
DBT
help
with
you there.
them? Thank you.
Yes.
Bipolar disorder, right?
No, borderline personality disorder.
Thank you.
So yeah, of course. So yes, I can talk about that. So I am, fully trained in DBT. So basically, in order to be a DBT therapist, you need to have my brain just totally stopped working. Sorry, let me get that back. Okay, like a foundational or a intensive training in the skills and in the strategies. And I then worked with Alec Miller, who took DBT for adults and adapted it for adolescents. So I have been working in the field of DBT, formally trained for probably 20 years, if not more. I think DBT for teens and young adults is probably my most favorite thing to do, because I feel like we want these kids to talk about hard stuff, but they have no skills and no strategies to do it. They have nothing kind of to hold them. But if we give them these skills, which all of them roll their eyes at, I can't tell you I have ever had a kid walk into a group and be like, so excited to be here and learn all these skills. Or like, I'm in group with my parents and this sucks and your snacks suck and everything is dumb. But by the end, I've got most of them kind of come back at me and say, hey, like this really did help. And if we think about teenagers, if we think about behavior on a continuum, right? Teenagers are kind of borderline personality disorders light, because if we look at what borderline personality disorder symptoms are, feelings of emptiness, mood lability, right? Their moods are all over the place. Kind of black and white thinking, chronic emptiness at different times. Well, adolescents kind of have all of that too. So I think, to me, DBT is life skills for adolescents. But when they're over on the continuum over here, they need more skills. And the hardest part in working with any teenager is getting their buy-in. And so some of that is just being kind of very radically genuine, telling them that you get that it's hard, recognizing why that they might not want to do these things, and really meeting them where they're at. So, for all the time that I've been doing that, that's really been the focal point for me. And not all kids want the skills. Sometimes they need to learn them more than once. But I think once they can see that some of them work, they're willing to do more. And that's a really big part of doing the work with that age range.
Thank you.
Mm-hmm.
Another question that came in: ADHD, ASD, anxiety, 15-year-old daughter. She has a history of self-harm, to deal with big emotions. She's currently in virtual DBT and in therapy, learning how to best support her and myself, and she hates to talk about feelings. Is there any additional things that we should be doing for her?
Great question. And all of those comorbidities make it harder, right? Because you're dealing with a lot of rigidity, black and white, yes or no, and if it doesn't work, it's never going to work. And I think that your best bet in those moments is a lot of patience, a lot of modeling of what it's like to talk about an emotion. So not that you want to dump your emotions on your kid, because you never want to do that. That's not their job, is not to help you manage your emotions. But God, that made me really anxious today when fill in the blank. And I realized I used my skills, or that made me really anxious today. What would you have done? So like making it a little bit away from her so that she can use kind of the strength of the intellect to mediate the emotion. We want her to get into her emotion, but sometimes helping somebody else allows us to recognize what's happening for us. And emotions can be scary. So we want to just kind of model that they're not scary, and model that they're manageable, and model that you can handle them, and reinforce every time you see us, not in a fake nonsense way, because kids see through that all the time. But if you see her being skillful, being like, oh my God, you handled that so amazingly well. I don't know that I would have done that so well. How did you do that? And then again, we're building connection, you're validating, you're recognizing, and you're reinforcing these beautiful ways that she's handling emotions in a way that maybe she didn't do before. But I think with teenagers especially, I look for what I call the just noticeable differences. We can't expect major change all at once, but if I notice a change from here to here, I'm going to highlight that, because I can't always expect a change from here to here, even though that's what I want. So, and I think that's very hard for parents. It's certainly very hard for parents I work with when they're like, but nothing's changing. And I'm like, but wait, this changed, right? So sometimes doing a little inventory too on what they might be doing differently is also really important.
Someone says, thank you for this. Can you please give some pointers in how to apply these principles to parenting a child with ADHD and ODD who has outbursts whenever he is asked to do regular, everyday routines and tasks?
Oh, yes. So I can't speak to this with as much expertise as I would like what I'm going to say. There's a lot of research happening right now with ADHD, and especially ADHD and ASD, and the whole kind of neurodiversity spectrum. And one of the things that they're looking into is something called PDA, pathological demand avoidance. Not PDA of like touch and love, but like, the fact that like when demands are placed on them, it's especially in younger people, that it feels so overwhelming that they can't do it. And so they like tantrum, they shut down. So I think that a couple things that I think would work, and again, it's new research, it isn't an official diagnosis, and I'm not an expert in that, but I will tell you what I think what I do with kids that do this is, and with parents is, you have to hold space for them and not engage in like, just stop, which is what all of us want to do. So there's that. And then so we want to hold space for them, and you want to have some conversations before certain things happen, right? So I think there is importance in being able to be like, hey, when we ask you to do these things, this stuff happens. This is a cope ahead moment. What can we do to make it easier? What can we do to make it better for you? We're not going to do it for you, but can we break it down into the steps that you need? Because maybe it's too many steps and they don't remember because of the ADHD. And so then they just kind of fall apart. So can you make a chart that they have to follow and check off, and they can earn certain rewards? And as they kind of build mastery, it feels better. So I think some of that, and you might want to look into into the PDA question if that's something that's happening for your child. But I think that sometimes we make too many demands all at once, and especially for ADHD kids, they can't tolerate that. So you got to break it down into smaller bites.
Thank you. Someone asks, what advice can you give to teachers?
I love that question. Teachers, so there is a whole manual for DBT for middle school that has been adapted in different ages, but there is a whole thing for in-school DBT stuff. I think you can do mindfulness practices in a classroom. I think validation goes so far for kids because, you know, just being able to be like, yeah, this is super frustrating. Beat, beat, beat. And we still have to do it, right? Like being able to validate kids and not just be like, let's go, we got to make it happen. That's hard. It's hard for kids to navigate that. So I think for sure having validation as much as possible is important. Having some mindfulness practice to kind of get everybody regulated in that. And I don't think mindfulness is only like, sit and breathe. Can you put on a song and everybody can dance around and like get their yayas out? Can they, you know, what can they bring in? And some of that can be emotion regulation, or can you create like a emotion regulation corner where you have or distress tolerance corner where they can go if they're feeling overwhelmed, and it has, you know, squeeze balls and something to write on or different things that you can throw in there. But I think teachers can really adapt some of these skills in there in really powerful ways because you have the opportunity to just kind of throw in that validation or throw in those moments. And I think there's a lot of really good SEL programming that helps just talk about what's an emotion and how do you identify emotion, and, you know, what emotion are you feeling today and what do you need, you know, and letting them ask that question, you know, asking them that question might be really powerful too.
At what age should parents consider therapy for a deeply feeling child with emotion dysregulation?
I don't know that it's ever too early. I know there's a lot of discussion around this now, but I don't know. I don't know that it's ever too early to teach kids some skills, and that may keep them out of therapy when they're teenagers, right? So if it feels like it just feels too big, I don't think there's any issue in ever asking for help. And you could always go to someone, and really ethical clinicians are going to be like, look, they're okay. And here's some things you can do. Or maybe it's more about going for some support for you as the parents. And then you learn how to navigate a big feeling kid and let them just be a big feeling kid. And they don't have to change that, but maybe you learn strategies on how to navigate that for yourselves. Because I think sometimes, especially for little guys, we're asking them to change their core person when maybe we need to kind of figure out how we as an environment, not in a like kid glove, whatever, but like how do we harness the best of them without having them have to change so much? And that sometimes has to come from the adults, not from the kid.
This is an interesting one. If you could magically implant into a teen's core belief system one belief that they would own, what would you suggest that would be?
Nothing matters as much as you think it does. Right? We think everything, teenagers think everything is like life or death. And it's going to be, you know, like if I could go back to my like 13, 14, 15, 16-year-old self, like all the things that I got so hung up on and thought was like the end of the world and like, oh my God, none of it really mattered. None of it mattered. Like that my hair didn't look like everybody else's didn't matter. But it, you know, it, like everything felt awful and like so huge. And I think that if teenagers especially can recognize like that none of it really, and that, because I think that encompasses, I don't have to agree with everybody. I don't have to do every TikTok dance. I don't have to follow every influencer, because none of those things are ultimately so important in the end of the day. What matters is like who you are and who your friends are. And like those things matter, but we get wrapped up in so much nonsense, and teenagers get wrapped up in so much nonsense, that if I could implant the core, if I can implant the value of like acceptance in all of these kids, we'd have much different kids, I think.
I like that a lot. Thank you. What are your favorite go-to emotion regulation or distress tolerance skills for children or teens that you did not mention yet?
So there's a whole list. I mean, I think my favorite distress tolerance skills are very much like I love pros and cons. I love making kids think about like the goods and the bads of what they're doing and why it's working or not working, because it forces them to slow down, right? If I'm like, all right, you want to go scream at, you want to go send that text to that friend at school because you're really pissed at them. Tell me the goods, the bads, like what's going to happen if you do that, right? And I think pros and cons is it's not an emotion regulation skill, it's a distress tolerance skill, but it is one of my favorites. Um, and I think for emotion regulation, like I think pleasant activities cannot be underestimated. And I think we dismiss that 2 minute, enjoyment of our first sip of coffee, or that 2 minute, like, anybody ever get a really good fountain soda and like that first sip of like really cold soda from the fountain? Like, I don't know, when you go like you drink it and you're like that moment, like I love that moment. And I'm just like moving on. But what if I just stopped for a minute and was like, wow, that was awesome? Could change my mood. So I think the simplicity of some of the pleasant activities cannot be dismissed and really needs to be embraced more.
Someone asked, how do we magically get the incredible level of experience Dr. Jen has overnight? That must have come from a therapist. So that's a compliment to you.
It is a compliment, and I so appreciate that, and thank you so much. And yeah, you can't, maybe, I don't know. I'm happy to talk to you about it, but I don't think you can. 20 years of it, I think, has got me in there. So, but thank you for the compliment. I appreciate it.
Someone asked, any books that you recommend for parents or therapists?
Yeah. So if you and I may have to send you a list of these because they're like, I'm going to get all the titles wrong because
Sure.
it's 9:20 and I don't have them in front of me. But there's some great books. Like if you're worried about your kid having borderline personality disorder and they're an adolescent, Blaise Aguirre, who is in charge of the DBT unit at McLean Hospital, has a book about dialectical behavior therapy with adolescents. That's the title. It's pretty simple. And there are great books by a woman named Pat Harvey about skills and strategies for highly emotionally, I think it's like skills, they're parenting books, skills for highly dysregulated children. Something like that is also can be super impactful, but they're all very skills based. And I will make sure that I get them to you, Mushki, so that we can share them with everybody.
Yeah, I'll share them.
But they are great parenting books that are really pretty simple. I think, pop culture wise, Brene Brown does great work on validation and vulnerability and the importance of all of those for ourselves and how they make us just more genuine, real people. So I think those are some of the ones that kind of pop to the top of my head.
Someone asked about, she has a client who smacks her child on the butt and would like to change that. What are the first couple of steps she can use to emotionally regulate?
Right. That's great. I think the first thing she has to do is literally like when she is noticed, right? This is where mindfulness is so powerful. Because she has to notice that like urge is coming, right? So something triggers her anger and the urge is to attack. So that mindful moment is to be able to be like, oh, I'm having that urge. I need to walk away for a second. And you can say, like, mom's going to go on timeout for a minute because I'm getting frustrated and I need to figure out what I need to do for myself. So I'm going to take a minute, but I'll be right back. And then you can kind of scream into a towel, stomp your feet, run your face under some cold water, whatever you need to do to get yourself regulated. But it models that taking a break is okay. And as long as you come back, you can't like disappear and you can't avoid the problem. But maybe you need to put yourself as an adult. Like I don't know, I put myself on timeout all the time. Like if I need a minute, take a minute and then come back. But the first thing is really mindfully is really starting some mindful noticing of where does the anger start? Does it start in her stomach? Does it start in her fingers? Does she notice her face flush? Does she notice her heart rate starts and really tapping into all of those things so she can label the emotion she's feeling and then figure out what to do with it.
What is the best way to find a therapist?
Oh my gosh, how much time do we have? It's such a hard, I wish I had an easy answer for this question. I think, first and foremost, if you're talking for your children, I would start with your pediatrician because they often are tapped into communities and they often know different resources. So they're a great resource. I think we still have a lot of stigma in this space. So we don't want to talk to our friends about it, but guess what? Many of your friends might be having their kids in therapy, and they may know really good therapists. Or the schools often have really good connections to the communities also. So that's usually where I suggest that people start, because, especially your pediatrician will know, hey, like this is what the kid's dealing with, so they need this kind of expertise. So let's look for this kind of a person. And so I think that can be super helpful, to just start with like the community that you're in, and especially the doctors that your kids are already seeing and engaging with. That's often where I would recommend starting first.
Thank you.
Mhm.
How do I get my children who are 6 and 4, they're comparing themselves with one another? How to address that?
So they're gonna. I mean, like sibling rivalry is a thing. It motivates us, right? But whatever my older brother had, I wanted. I mean, it's not fair. Some of that is life, and some of that you're not going to be able to convince out of them at all. But you can kind of be like, okay, so I know you want what your sibling has, but what do you have now? And it's a lesson in disappointment in some ways, because they're not always going to be equal. The older one might get more privileges, or the older one might have different rules, and that the rules might not be the same for
You swell.
everybody.
Can you go to
And
my
all
room
of
and get
that
me my
is
wire? And Dina, love.
all of that
Sorry
is
about that.
okay. That's okay. All of that is okay. And I think it's also really important to, kind of help them highlight. It's hard at 6 and 4, but I'm going to use the word gratitude, like kind of acknowledgement of the things that are okay, that like you might have that your brother doesn't have, and this is okay. And we're not all going to have everything the same. And kids need to tolerate disappointment, and that things aren't always going to be the same. And that's hard. But comparison, like while we know that it is the thief of joy, sibling rivalry does exist, and those things do exist within that space.
How do you deal with social anxiety? Someone that's always worried about having friends and not being liked and popular. How do you address that?
It's a hard one. And I think that social anxiety is really pervasive for so many young people right now. And I think that kind of the fact that a lot of young kids had such a period of time on screens during COVID makes it that much harder, that they don't have all the skills and the strategies. So, our urge is always to convince them that they're wrong. But sometimes they're not. Sometimes they are right, that they don't have a lot of friends. So it is helping them to identify, to validate, hey, it's really scary when you feel like you don't fit in. Who is someone that you trust, right? Who is someone at school that you do feel confident with? Who is someone that you feel you can be connected to and around, so that you are highlighting that there are people for them without being like, but what about Joe? He's your friend. And what about Sam? And we do a lot of that where we're trying to convince them out of their feeling. And that's where validation is so important, because it opens up conversation, not convincing. And so I think that's a really important place to start. And these are the kinds of kids that sometimes do need therapeutic intervention to help them really kind of shut that inner critic and negative self-talk up, and help them kind of see that there are other opportunities or other options that they just can't see in the moment.
On that question, I'd like to put a plug that our next event that's on November 19th is on the topic of social anxiety and interpersonal effectiveness. So definitely join us for that. Okay, someone asked advice on what to do when your child gets closed off and defensive and wants to be left alone when they are dysregulated.
Yeah, so I think you can let them have that space, and let them know that there's a time limit. So oftentimes, if you're not worried about their safety, not necessarily an issue, because all of us deal with dysregulation differently. But if you're worried about their safety, especially, I often kind of say, look, I'm going to give you 5 or 10, I'm going to give you 15 minutes, and then I'm going to come back and check on you. And I want to kind of be able to talk to you about what's going on, but I recognize that you need a little space to kind of get your thoughts in order or to calm yourself down, but I'm going to come check on you in 15 minutes. And they're going to be like, don't check on me. I don't need you to check on me. And you're not going to listen to them. You're going to check on them anyway. And then you're going to, hey, I would like to be here for you and be able to support you. Can I just sit with you? And sometimes that's enough to get them talking, right? But they need to know that you are not afraid of their emotions. And someone put in the chat that the Dr. Becky book, right? And Dr. Becky talks about this a lot. Like, your kids need to know that you are not afraid of their emotions, and that doesn't mean you aren't, you might have to act the opposite to your own fear of their emotion. Let's be honest. They might be scary, and their emotions might be scary, but you have to be able to, especially for your children, show them in that moment that you're not scared, right? Unless you really are scared. And then you might be like, hey, I'm really nervous about how dysregulated you are. We need to figure out how to help you calm down. What can we do? Or do we need more support than this? And you know, when kids are really at risk for suicide or are at risk for self-harm, that may mean like having to go to the hospital and engage other people to keep them safe. But I think if they need a little bit of time on their own, like that's okay. They can have it, but don't just ignore it. Like go check in, go, you know, make it a touch point. I'm going to come back in 15. I'm going to come back in another 15 and actually follow through, because that's behavioral validation, not just verbal validation, and really important.
All right, we'll take our last two questions.
Sure.
My 4-year-old screams when he wants something, and he will just scream for whatever he's asking for. What to do?
Oh, 4-year-old screamers, we love them. You know, we didn't talk about behavioral principles. We just talked about the validation, but this is one of those moments where the screaming can be embarrassing, especially if they're doing it in a store. And so there need to be kind of behavioral, you know, there need to be consequences and there need to be rewards when it doesn't happen, not crazy rewards. Praise is enough of a reward for a lot of kids, but you know, you need, if he starts screaming and you need, you know, how do you just, can you scoop him up and walk him out? Or do you have to wait him out? But like withdraw attention and he'll get louder, but ultimately he'll get quieter because he's not getting the attention he wants. You need to let him know that you're not going to give him any attention when he's screaming. And he's going to, and what he'll do is have what they call a behavior burst. It'll get worse before it gets better. But if you can stick to your guns, always the hardest thing, it'll change. We often give in when we are uncomfortable, and then we're reinforcing the behaviors we're trying to stop. But it's really hard. The screaming is so hard, and it like hurts your ears, and you just want them to stop doing it. So you give in, but it actually, you're reinforcing the yelling. You're not reinforcing the quiet.
Someone asked, how do you address self-injurious behavior?
As a whole, or I mean, like I'll give you a general, right? I'll give a general, like you know, in DBT we have a lot of kind of safeguards, and not safeguards. We have a lot of kind of guidelines on how to do it, right? So if I have a kid that's coming in and is self-injuring, you know, they have access to me for coaching. We're going to talk about what the parameters are on what leads to them having to go to the hospital or not. What leads to me breaking confidentiality with parents or not, right? Okay. Those are all important kind of elements that they need to understand. I don't expect them to stop self-injuring the second they walk in my office. That's totally illogical and won't happen. But we do a lot of exploration into the whys, the whats. I will also have parents kind of sanitize the house and get rid of, it's an inconvenience to the house, but like get rid of all the sharp objects or lock knives up or do all of that. Do I also know kids can absolutely get access to those things when they want? Yeah, they can. And we acknowledge that, right? But most kids recognize that the self-injurious behavior, why do they do it, right? It's emotion regulation. It's because they feel shame that they're not perfect. But it becomes their main emotion regulation skill. So if we can teach them alternative skills that might not work as fast, but do ultimately work, their buy-in gets more. And you know, one of the biggest things for so many of these kids is like, oh, well, if I stop self-harming, my parents will get off my back, or they'll like give me more privacy. Like that's a big carrot for so many of them. So, you know, but it doesn't come easily, and it's a lot about building rapport, and it's a lot about managing parental anxiety that like they may still self-harm for a little while, but we're working on making it better. And that's really hard because it's a very anxiety provoking situation for everybody.
Thank you so much. We have come to time.
Yeah.
There were a few more questions that came in, which I wish we can get to. People want to know if there's a way to contact you through email.
Yes, actually, there is. I will put it in the chat for everybody.
Wonderful.
Everyone, and in if you distribute the slides, it's in the slides.
Okay.
I think so. Yes, it is in the slides. It's the last slide of the slides also, but I will put it here so everybody can have it if I can see what I'm doing.
All right.
And the answer to that last question, Naomi, is yes. Naomi asked if it's effective for young neurodivergent kids, and there's a lot of research taking DBT to be using it with neurodivergent populations.
Thank you. Thank you so
You got it.
much, Dr. Jennifer Hartstein, for your eye-opening and practical presentation on emotion regulation skills. A survey will be sent to all of you, was already sent through email, asking for your feedback on this event, and please fill it out so that will help us plan future events. And the recording of tonight's event will also be sent to everyone who registered in the coming days, so please look out for that. Our next event, as I mentioned earlier, From Loneliness to Interpersonal Success, Strategies to Help Your Child Navigate Social Waters, will be on Tuesday, November 19th with Dr. Anne-Marie Albano from Columbia University, and the link will be in the follow-up email as well. We look forward to seeing you there. And thank you again for joining us. And thank you, Dr. Hartstein. Good night, everyone.
Thank you, guys. Good night, everybody. Have a great night.
Bye.
Good night, everyone.